Hi everyone, my name is Hannah Bender. I'm the Director of Educational Services with Medical Missions Outreach, and I'm here to talk to you about traveling with the disease. When I go to different, whether it's schools, churches, to talk about MMO, I frequently hear this question of, can I even travel because I have fill in the blank, whatever disease process? And I'm here to tell you that it is possible. I'm a type 1 diabetic, so I have an insulin pump, and I've been traveling with MMO since 2016. So it definitely is possible, but it does require some extra planning. So I'm here to give you a few tips. First off, before your trip. So the biggest part of traveling with the disease is planning. You definitely want to involve your healthcare provider in a plan, whether it's your doctor, your nurse practitioner. Just talk through what medications you typically take and how it would look to take this in a different context. So that includes, how do you travel with those medications? You're going to want to prepare enough medication to bring with you. You definitely want at least 2 times the amount of medication you would need. This goes the same for supplies. If you think you're going to be traveling with us for 10 days, go ahead and travel and pack for at least 20 or 30 days worth of medication and supplies. When you're packing your medication, you want to make sure to leave it in its original bottle. So this is my insulin, it's got the original script on it. That's going to be super important for you as you travel, just to prove that whatever medication is what it is. You definitely want to leave it in your pill bottle if you can, just as you travel again. If you're worried about refilling a prescription too soon to the date where it's able to be refilled, that's actually not true. So you can override and have it's called like a vacation fulfillment of your prescription. So you can go ahead and do that. And you just talk to the pharmacist, say that you need an override for a vacation, and they will do that. If it's not quite time for you to refill, they can do that for you so that you have all the medications that you need. I'd say another part in preparing is going to be, let's say you take a certain medication at 10 p.m. before you go to bed every single night. Well, it may be that you're on a trip where we're going to the Philippines, or we're going somewhere in Africa where we're going through significant time changes. So that's really important to talk through of, do I take an extra dose? Do I skip a dose? These are questions to work through with your provider. So you want to make sure that you know what you're doing in that way, just to be safe. I'd say, so the next step in preparing, as you're packing your medication, you want to make sure to pack some on your carry-on. I would honestly do most of it on your carry-on if you can, just to have it with you. But if you need to split it, definitely carry at least half of it with you on your person as you're packing, and not in your checked bag. You want to make sure to, just in case you were to become separated from your checked bag, that you really have all those medications that you need with you. As far as that goes, a lot of people do prefer to have a script as well in case they needed to refill a prescription while they're overseas. So you can definitely either take a picture, that's what I would do, just to have a picture of your script in case you need it. That's also something good to prepare for. So when you're going through airport security, they're definitely going to have you, remove things. If there's a liquid medication like insulin you're traveling with, you're going to remove it just like any other liquid. And if you're like me, you might have some kind of hardware that you have that would light up in a metal detector or in the scanner. Some people light up a room. I light up the scanner with all of my pumps and continuous glucose monitors and all these things. That's definitely something that you want to just let the airport personnel know as you're being scanned or as you're going through, that you have that device on you. So for instance, to come out of frame for a second, but when I'm going through security, I have this little guy. This is my continuous glucose monitor, but when you take this through airport security, it can look like a gun. So you just want to let them know. I've definitely been asked before what's in your bag, and it's helpful to have a doctor's note. I'm just saying, this is my patient, Hannah. She travels with a continuous glucose monitor, insulin pump, syringes, whatever you think is necessary. Having that note can just give you some peace of mind to show them if they have questions. I've been able to just explain, never really had an issue, but definitely the doctors are used to being asked to write those kinds of notes. So if that's something that would put your mind at ease, by all means, ask them for a note just to say exactly what it is that you're carrying with you. And then the last step, I would say, that has to do with so we talked about packing for the trip. In the airport, the last step of it is really being on the field. So the biggest thing that you can do to stay safe while you're traveling is just preparing again. So if you know that you're going to need a snack halfway through the day, pack the snack. If you know you need your medications at a certain time, make sure you have bottled water so that you can take those medications safely. And then the last part I have is just really communicate with our team. So when you're signing up, we ask you questions about any kind of healthcare concerns, any dietary concerns, any allergies. Those questions just help our staff to take care of you appropriately too, and just to be aware if you could be having a hypoglycemic episode, if you could be having another type of scenario. It just helps our team to know how to best take care of you. And if you are to take care of patients on our trips, then you really have to take care of yourself. So definitely don't be afraid to communicate with us. And we are there for you, and we definitely want you to feel safe and comfortable on the trip. So thank you so much for taking this first step with us to sign up for a trip and to start to work through some of these questions. We're excited to see what God's going to do. And if you have more questions, my name again is Hannah. You can email me at hannah@medical-outreach.com. I'd love to try to answer or to point you in the right direction to someone who can. So thank you. Have a great day.